What if I told you that you could stop brain damage in its tracks with cold? It sounds like science fiction, right? Well, today we are diving into a truly remarkable medical treatment called therapeutic hypothermia. It's a cutting edge procedure that literally uses controlled cooling to rescue the brains of newborn babies at their most fragile moment. Okay, so for most families, birth is one of the most incredible moments of their lives. But for some tiny infants, those very first moments are a crisis. A sudden lock of oxygen to the brain can kick off this just devastating chain of events, putting the baby's entire life and future at risk. And that leads us to the big question, the one that doctors and scientists have grappled with for years. When that oxygen supply line is cut, what can you possibly do? How can you step in and prevent permanent damage in an organ as complex and delicate as a newborn's brain? The stakes, as you can imagine, are just impossibly high. Now, there's a medical term for this, and it's hypoxic ischemic encephalopathy, or HIE for short. Let's just break that down really quick. Hypoxic means not enough oxygen. Ischemic means not enough blood is flowing. And encephalopathy just means damage to the brain. So you've got this triple threat, all attacking the brain right at its very beginning. And the consequences of HIE are, well, they're severe. For babies with the most serious form of this condition, the mortality rate is a staggering 60%. Think about that. And for the ones who do survive, many are left facing lifelong disabilities. So you can see why finding a treatment that actually works isn't just important, it's completely life-altering. But here's where the story takes a turn, where the science gets incredibly hopeful. It turns out that the brain damage from HIE doesn't all happen in one big bang. There's this critical but very, very short window of time where doctors can actually step in and change everything. You see, the injury comes in two distinct waves. The first one is called primary neuronal death. This happens instantly, right when the oxygen is cut off. The brain cells are literally starved of energy, and they start to die. Now, this initial damage, sadly, is permanent. But then there's a pause, a quiet period. And after that, a second, much more destructive wave of injury gets going. This is called delayed neuronal death. And it's like a perfect storm of inflammation and toxic reactions that causes a huge chunk of the final brain damage. And this is the wave we can fight. And this timeline just lays it out perfectly. Right after that initial hit, there's this latent period of roughly 6 hours. That is the golden window. It's our only chance. If you can start a treatment right there, you can stop that second wave before it even gets started. But after 6 hours, that window slams shut, and that delayed cell death really starts to take over. The clock is ticking. So how in the world do you fight that second wave? You do it with a treatment called therapeutic hypothermia, which I should say is now considered the absolute standard of care for these babies. The idea is to lower the baby's body temperature, which slows down the brain's metabolism and stops those toxic processes in their tracks. There are basically two ways to do this. First, there's selective head cooling, which uses a little cap to cool just the head. Then there's whole body cooling, which uses a high-tech blanket. Now, whole body is often the way to go because it cools everything uniformly. And this is key. It makes it way easier to do the continuous brain monitoring that is absolutely essential during this treatment. And I want to be clear, this is a super precise, carefully controlled process. The baby's temperature is brought down to about 33.5 degrees Celsius, that's 92.3 Fahrenheit, and it's held there, rock steady, for exactly 72 hours. Then they are rewarmed incredibly slowly. This isn't just sticking a fan on them. It requires really sophisticated, servo-controlled equipment to hit and hold that temperature perfectly. But just cooling the baby is only half the battle, because you can't treat what you can't see. And that's where this other piece of incredible technology comes in, Amplitude Integrated EEG, or AEE. It gives the NICU team a continuous, real-time window into what's happening inside the baby's brain. It's like having eyes on the inside. And let me tell you, for a top-tier cooling program, this is completely non-negotiable. The AEEG lets doctors see how the brain is recovering, it helps predict future outcomes, and, this is so important, it detects seizures. Get this, about half of these babies have silent seizures. Seizures you can't see just by looking at them, but they can cause massive amounts of further damage. Without AEG monitoring, you are literally flying blind. Okay, so we've got the theory, and we've got the technology. But the million-dollar question is, does it actually work? Well, over the last couple of decades, major international clinical trials have put this therapy through the ringer to find out. And the results are just, wow. They're so incredibly consistent. In these huge landmark trials, the NICHD, TOBY, and ICE trials, you see the same pattern every time. The group of babies that got the cooling therapy had a much, much lower rate of death or severe disability compared to the babies who didn't. This isn't some tiny effect. It's a total game changer. And when you pool all that data together, the benefit is just undeniable. We're talking a 24% reduction in the risk of death or severe disability in high-income countries. And look at this. In low and middle-income countries, the potential benefit is even bigger, a 43% reduction. It's huge. So this brings up a really important question. If the potential benefit is so massive, does this high-tech treatment work equally well in every single hospital, especially in places that might not have as many resources? And that right there is the heart of the current debate. This statement from India's National Neonatology Forum nails it. There's been this real uncertainty about how to best roll this out in settings where the overall level of care might be a little different. Because it turns out the success of this treatment is tied to the entire system of care around it. It's fascinating. Some studies found that if a baby showed up at the hospital already cold, maybe from a long and difficult transport, the therapy didn't work as well. So this isn't just about owning a cooling machine. It's about having a high-quality, fully supported intensive care unit to back it up. So what's the bottom line? Well, the evidence is crystal clear. Therapeutic hypothermia saves brains, period. The goal has to be making this the standard of care for every single baby who needs it. And that means making sure the right infrastructure is there to support it. And what does that infrastructure look like? Well, you need a top-tier level 3 or 4 ICU. You need expert doctors and nurses on site 24/7. You absolutely must have continuous monitoring for things like blood pressure, heart rate, and of course, that vital AEEG. And it also means having access to things like MRI and committing to follow-up care for these kids long after they leave the hospital. Which brings us right here to our final critical thought. The science is done. It's settled. The life-saving technology, both the precision cooling devices and the essential AEE monitors, it all exists. We know exactly what it takes to build a successful program that saves lives. So the question isn't if we should be doing this anymore. The question is, how do we make sure that every single baby, no matter where they're born, gets access to this Icy Rescue?